In my opinion, some important things for healthcare providers to remember about MDS is that it's a heterogeneous disease. And it's actually many different diseases in one. And that the patient should be treated as individuals, and that their overall goals of care and care plan should be a discussion with the patient and what they wish to do. And I would just emphasize that in general, most patients are undertreated rather than overtreated.
Myelodysplastic syndromes have generally been somewhat difficult. I think one of the more difficult cancers because of to understand because of all the differences that we discussed throughout the last hour. And I do think that trying to understand the disease and trying to understand the patient needs is very important. We are, I think, entering an era in which we are going to have, more and more therapies and more segmentation of patients into subgroups based on molecular or other biomarkers to choose therapies, similar to what has happened in AML. And I think we are going to continue in that direction. We are going to have, more and more clinical trials looking at combination-based therapies, and potentially we just have the first combination with azacitidine and venetoclax in AML approved, and there are trials looking at different combinations in MDS. And I think that the therapy is going to become more complex. Those patients, I think, will have to be managed in collaboration with experienced physicians who are like more up to date on the data. And I think we'll probably have to establish algorithms to or clinical pathways to try to treat these patients. I think in the most effective way that is, looking both at the efficacy as well as the quality of life and reducing inconvenience to patients in terms of these therapies. So if we cannot cure most patients, I think the goal will be to try to prolong survival as much as possible and maintain a very good quality of life and transfusion independence.